Every drop of blood carries a story, and iron is its hero. When that hero goes missing, your body pays the price. Welcome to Mediverse Atlas. Today we are going to talk about iron deficiency anemia. In this video, we'll try to understand what exactly is this iron deficiency anemia. What happens when our body lacks iron? We all know that hemoglobin is an important constituent of RBC, and this hemoglobin carries oxygen to our tissues, right? Now, if there is no iron, there will be no synthesis of hemoglobin. If there will be no synthesis of hemoglobin, RBC's size decreases and RBC's color becomes pale. So, in iron deficiency anemia, the morphology of RBC is manifested as microcytic hypochromic. So, this iron deficiency anemia is caused by insufficient iron for hemoglobin synthesis, leading to the production of small, pale red blood cells. Now, what is the RDA of iron? The recommended daily allowance of iron. In an adult male, RDA is about 5 to 10 milligrams per day. In adult female, it is about 10 to 20 milligrams per day. And when a woman is on gestation or lactating, the RDA goes up to 40 mg per day. Now, what are the exact causes of this iron deficiency anemia? There are almost four causes of this iron deficiency anemia. The first one is due to the inadequate dietary intake. When does this inadequate dietary intake can be manifested? In milk-fed infants. If the infant is only fed with milk for a long period of time, so there will be deficiency of iron leading to iron deficiency anemia. And people with poor socio-economic status. And in anorexia, anorexia is simply nothing but the feeling of not having food or loss of appetite in simple words. So the second cause is increased loss of iron from the body. Now, when does this increased loss of iron happens? First, in the uterine bleeding in females, if there is excessive menstruation or repeated miscarriages or post-menopausal bleeding. And the second one is due to the chronic blood loss due to worm infestation. If there is any hookworm present in our body, so there will be chronic blood loss. Or in case of peptic ulcers and piles also, chronic blood loss can be manifested, which leads to iron deficiency anemia. And the third one is increased demand of iron. Increased demand of iron is seen in infancy, childhood and adolescence, and even in menstruating females and pregnant females. And the fourth one is the decreased absorption of iron. When there is decreased absorption of iron is seen in partial or total gastrectomy or achlorohydria or any malabsorption syndrome. Now, let us look at the clinical features of this iron deficiency anemia. So, what are the symptoms? So, the general symptoms include pallor, the pale appearance of the subject or the patient, fatigue, weakness, dyspnea, and palpitations. The epithelial changes or the tissue changes are cholionychia, that is the spoon-shaped nails. The subject manifests the spoon-shaped nails. The glossitis, angular stomatitis, and dry skin. Angular stomatitis is nothing but there will be cracks at the angles of mouth. You can see here, na, there are cracks at the angles of mouth. So this is angular stomatitis. And glossitis means atrophy of the tongue papilla or redness of tongue. The tongue turns into angry red in color. So glossitis is this. And cholionychia, that is spoon-shaped nails, are seen in the iron deficiency anemia. And what are the GIT symptoms, the gastrointestinal tract symptoms? So there will be loss of appetite, dysphagia, and pica. What is this pica? In this is a symptom of iron deficiency anemia in which the patient craves for ice, clay, or chalk, or even rice. And the other symptoms include the irritability and poor concentration. Now, what are the laboratory findings? The general liability findings, when as soon as the patient enters into the OPD, will be suggesting for a CBC, the complete blood count or complete blood picture, in which we can find there will be decreased concentration of hemoglobin, and the blood indices, the MCV, MCH, and MCHC will be decreased, along with the RBCs manifesting the microcytic hypochromic morphology. And in peripheral smear, we all do peripheral smear in physiology lab. So in the peripheral smear shows anisocytosis and poikilocytosis. What is this anisocytosis? An iso meaning the abnormal shape, abnormal size, and iso means abnormal in size, and poikilocytosis means abnormal shape. Aniso means abnormal size, poikilocytosis means abnormal shape. In this peripheral smear, you can manifest it. So this is the normal RBC, in which you can see the RBCs are very healthy. But in this picture, you can see that the RBCs are not normal. So they are irregular in shape and they are irregular in size, manifesting the microcytic hypochromic nature. You can see that the size of RBC is decreased, and even the color of RBC is also not normal. Okay, these are the findings of the peripheral smear. And the bone marrow findings include erythroid hyperplasia. Now, what exactly is this erythroid hyperplasia? Erythroid hyperplasia is nothing but the increased production of the uh, early erythroblasts. To be in short, early erythroblasts. So, the hematopoietic stem cells will be increased in the erythroid hyperplasia. And what are the biochemical findings? Decreased serum iron. The normal serum iron ranges between 60 to 160 mg%, and decreased serum ferritin and increased total iron binding capacity. You will be learning about these biochemical findings more in the biochemistry department. Now, what does the treatment include? Treatment includes oral administration of Fe2 plus salts, or the oral iron therapy, or the iron tablets. Next, the correction of causative factor. Example, deworming. Suppose if the person has worms, which worm? Hookworm. We can manifest hookworm in the patient sometimes. So hookworm, if there is any hookworm infestation, so deworming must be done as the primary treatment. And what will be the prevention? We have talked about the treatment. We have to talk about the prevention also. Eat healthy and stay healthy. Thank you. If you have any doubts, please do comment in the comment section, and see you all. Bye.